My name's LaSonya, and I am a variety of things. I'm a Black woman, but I'm also a mother, a wife. I am a professor of nursing. I am a nurse practitioner of both family and women's health. I'm really in tune with my body. If something is off, I find out what's going on right away. I don't waste a whole lot of time, I'm trying to figure things out. If it's something that, especially when this happened, I had just recovered from an elective procedure and I was getting ready to go back to my regular work. And I noticed one day that I had blood in my urine. And then it just seemed like it was a lot of blood. It was just wasn't like a little bit. And I saw some blood clots and I was thinking, well, I know I'm not on my menstrual cycle. So what is going on with this? So I just thought, well, maybe it's something from my surgical procedure. Maybe, although it was time for me to go back to work, it had been a month prior, maybe that's what it is. So I called my surgeon and I said, hey, this is happening to me. And he said, well, it doesn't seem like this is something that will be related to your surgery, but we'll go ahead and have you go in for a urine test and see if you have a urinary tract infection. So I did that. So I went in and went in for urine analysis. It came back negative for infection, but positive for blood. So he said, well, you need to follow up with your primary doctor. So I called my primary doctor. I went in for a CAT scan a few days later, and it came back that I had a mass in my blood. Being that I'm a nurse practitioner, I knew what that meant. And for us, we think of blood in the urine. It could be a urinary tract infection. It could be kidney stones. Worst case scenario is bladder cancer. So the next step was going to be that I would have to see a urologist. We went to our appointment for the urologist and he scoped my bladder. And when he scoped the bladder, we could see the actual mass. And he said, in fact, that it was bladder cancer. I think I was kind of already prepping myself mentally for that outcome, but it was still devastating. I mean, I was a nervous wreck at that point. So it took me like a week or two to kind of get myself together mentally for what was next. Because the next thing that they needed to do was to do the biopsy, resect it, and see what stage of cancer it was. So I had started doing a lot of reading. My biggest concern was, is this muscle invasive? Because if it is, that means that I'm going to have my bladder removed, chemo and chemo, not radiation, but chemo, and all this stuff is going to happen really fast. The results came in for my pathology. We went back into the doctor, and the doctor says, I'm so sorry. I thought that this was a superficial situation, but comes to find out that you have a high-grade bladder cancer. And these types of cancers have a tendency to come, even though we removed the tumor, they have a high likelihood of returning. Probably, it's very, very high likelihood of returning. The good news was that to me, he says that it hasn't gotten to the muscle, and they did the resection, which turned out really well. And then we started the BCG. It's an infusion and it's still directly in your bladder. And you have to actually hold it in your bladder for 2 hours, and then you can pee it out. The thing about it is that even though when you start peeing it out, you for the first, I believe it's 4 hours, that you have to put bleach in the toilet. You have to be careful that nobody else uses the toilet because this is a chemical. So, and of course with chemicals, there are side effects. So some of the side effects I was having is like the first day would be fine. The second day I would have joint pain, like flu-like symptoms, tired, fatigue. I might have pain with urination, bladder spasms. And the more treatments I had, kind of like the more irritated and the more irritable it became. And I had more of that. So the BCG was better than chemo, but it still was, it was hectic because, with the burning with urination, it didn't matter what they gave you for the burning. It just was not gonna do it. You know, it might take the edge off, but that was pretty much it. Once they did the first 6 weeks of BCG, during that time, I think I had one bladder infection, so that delayed the treatment for a week because I had to take antibiotics and then I had to go back and finish. At the end of it, they wait so many weeks, and I believe it was 8 weeks, and then they scope you again. So on the 8-week scope, they saw an area. We saw an area in my bladder. I had no new tumors that they could see, but they saw a bumpy area. So there was a bumpy area in it, and she just wanted to watch it. And so at that point, you would be having maintenance BCG immunotherapy every 3 months for whatever the prescribed time was going to be. When I got to the point where I had my second scope after the 3-week BCG maintenance, we went back in, and that's when my treatment took a different turn. So when they went in to scope my bladder, again, I didn't have any new tumors, but that bumpy area had gotten bigger. So the doctor said, I want to take it out. And I said, I want you to take it out. Now, thinking about that, what might someone else have done, right? So you think about, well, if I was seeing this doctor over here or that doctor over there, just because it's not a tumor, are we going to keep watching it, right? And keep doing the BCG? Well, I was so happy that she wanted to do the procedure. So she went in, resectioned it, pulled it, took it out, sent it to pathology. Came back. When she was in there, she found another small tumor that wasn't even detected on the scope. So she took that out too, and she sent that to pathology. That area that was flat and bumpy that came back was the same cancer that I originally had. It just wasn't growing in the bladder, it was growing down. So it had not reached the muscle yet. Thank God, it was still in that. It had gotten to that layer, but it hadn't broken through to the muscle wall. So again, that makes the difference between chemotherapy or something else, right? So she also found another type of bladder cancer, CIN, carcinoma and C2, some other type of cancer in it. So I had already done some research on that one, and I knew that most people who have that, it just comes back and back and back. Like it'll be 1 now, next time it'll be 3, next time it'll be 5. You know, and eventually all roads lead to bladder removal for most people. Okay, and I said, every time you wait and all these treatments that I'm having, you're rolling the dice that it's going to get to the muscle. And I said, my bladder is actively trying to kill me. It's my bladder or me. What's it going to be? And I decided I'd rather it be my bladder to go. And I said, you know, I'm going to stay here. I'm determined to be here. And I said, right now, if I go ahead and do the surgery, I have choices on the outcome. If you wait too long, 1, it could get into the bladder wall. 2, it could get outside of the bladder wall, because the bladder wall of the wall of the bladder is very thin. It sits right on top of the uterus. Once it gets out, it goes quick. People go quick. I mean, it's just, you know, you're taking chances. And I've never been one to really take a lot of chances, especially with my life. And I know my kids need me. I know my husband needs me. I know that I have a lot of responsibility, and I really want to be here. And I talked to my doctor, and I said, when she gave me the final pathology, I said, I really think that I want to have my bladder out. At that point, it was a decision as to, well, what type of diversion am I going to have? So I went ahead and decided I would do the Indiana pouch. So I just have a little catheter. It can fit in the palm of my hand. And if I go to the bathroom, I just open it up. It's all sterile. I can touch it and everything on the outside. And I just feed it in. I stand there and I pee. I take it out, throw it in the trash, and I'm on my way. For me, I thought about this. 1, I didn't want the bag. So that was going to be out. That was not going to be an option for me. Also, I knew that if my other diversion failed, I could always go to the bag. You always go to the bag later, but you can't go back once you decide you want the bag. This is for the rest of my life. Who's going to cath me when I can't see down there? My husband, he won't be able to see either. So who's going to do it, right? But if I have the Indiana pouch, if someone's taking care of me, it's really easy for them to take care of me. So we're back here at the same beach where we said I do. I thought about a variety of things. I thought about the right now. I thought about the future. I thought about the things that I like to do. My husband and I, we love to go to concerts, outdoor venues, festivals. Usually there's porta potties involved sometimes and all that kind of stuff. Is that going to be conducive to my lifestyle now? I mean, what about when we travel and we like to travel, we like to go overseas? Is that going to be a problem? And all of these things are, manageable with my diversion. Fortunately, everything turned out well. I had a couple little setbacks along the way during my recovery period, but I would not change anything. I'm just so glad that I made this decision. And really, other than having to go to the bathroom on a schedule every 4 to 6 hours, I have to go empty my bladder. But most people I know, women I know, they go to the bathroom more than that. So around the time that, before the resection, around the time that I transferred my care to City of Hope, I joined a support group, a bladder cancer support group on Facebook. So I started just looking for bladder cancer support. And I found a couple of groups. One was women in bladder cancer. The other one was just bladder cancer itself. That experience of connecting with people that were going through the same things that I had gone through, that had gone through what I'd gone through, so I could ask questions, they could offer me support. That was invaluable. It was invaluable, while I was going through my process. And in fact, I've met some lifelong friends since I joined the group. The first person I met was a woman that lived in New Jersey, and she was diagnosed with the same cancer that I have, high-grade bladder cancer. However, hers was caught at an earlier stage. I call her my cancer wife. My bladder cancer wife. I got to meet her for the first time when we had lunch together, and it was the best. You think we've known each other for years. It was the best thing ever. I think we both cried because we had been going through this journey. We got diagnosed weeks apart, and we had been going through this journey together, supporting each other. We exchanged numbers from after meeting on Facebook, and then we just started texting each other back and forth, and we became really fast friends. And we've been friends like ever since. So every scan, and sometimes I found myself calling her before I called my husband. That's why I said she's my cancer wife. Like before the scan, she'd call me, I call her before her scans. We comfort each other, and it's so funny. This Black lady and this little Jewish lady, and we're just like, I think we're a year apart in age, and we have just bonded to one another, and she is truly my sister. And this is another reason why the support groups are really important. During the course of the support group, when they do a surgery of this nature, is major. So they not only remove your bladder, but they remove your ovaries. They remove part of your vagina because your bladder sits right on top of your vagina. So there's part of it that has to be removed. In some cases, they remove most of the vagina, especially if they think there's a possibility that cancer has gotten through that. And they take out your appendix and a bunch of lymph nodes, lots of lymph nodes. So when you're thinking about being married and being young and not having a vagina, that could be traumatic to your relationship. So I never would have thought to ask, but somebody in my support group brought it up, and I talked to her, and she became one of my close friends too. And when she had her bladder removal surgery, they removed all of her vagina except for maybe 2 inches, which means that she would have to come back later and have a reconstruction of her vagina. And I was like, oh no, that is what I'm not doing. I said, I don't have muscle invasive disease, so it's not out of my bladder. I do not want to have no vagina. So I talked to my doctor ahead of time, and I said, if I wake up and I don't have a vagina, all hell's gonna break loose. So we need to make sure that I wake up with a vagina. So she said, we'll do vagina-sparing. I said, yes. I said, I want to make sure I have a working vagina. So it was very nice that I was able to consult with the plastic surgeon. Another reason to go to these big cancer centers is because they have all that there. All these doctors are there. The plastic surgeon was there, and he went through the procedure. He said, if they get in there, I said, if they get in there and there's a problem, I expect to wake up and still have a vagina. So he told me the procedure. He said, if they get in there and they have to remove everything, then I'll either take part of your muscle from your thigh or from your abdomen, and I will make you a vagina. So you're not going to wake up and not have a vagina, no matter what. I said, you promise I'm not going to wake up and there's, he said, no. He said, I will fix it. I said, you know, of course you can go back. It seems like something small when you have cancer, but it's not. It's still quality of life. It's living your life and living your life abundantly. It's not just living life, right? So I was like, I want it all. You know, if I have to go through all this, I want to make sure that I'm going to have what I need to be happy and all those things. Now that the bladder is gone, I don't have to worry about bladder cancer, but of course I'm going to be monitored for the next 5 years. Well, I think for the next 5 years, every 3 to 6 months, I have to be scoped. In fact, in 2 weeks, I have my next scope CAT scan, and then they'll scope my pouch, which because I don't have a bladder anymore. And then after 5 years, every year for the rest of my life, I'll be monitored. So scoped and probably CAT scan to make sure that there's no recurrence there or anywhere else. So, and that's a blessing to me. The only thing I have to share is that listen to your body. And I think I said this in the beginning, that something's, if you feel like something's not right, it's not right. And it doesn't matter if they say that, oh, everything's okay. You have to remember these things. If you die, they're going to get another patient. The only people that are going to be affected by my death are the people that love me. And I love myself. So if I feel like something is not right, I'm going to get a second opinion. Why? Because I'm entitled to one. And that's what I'm going to get. I'm entitled to do research, you know, and I'm going to do whatever research I need. I'm going to try to find, you know, again, going back to the Lord helps those who help themselves. Sometimes we got to go out and help ourselves. I just did my own research. I went and called City of Hope. I found out that they had other clinics. And the first thing I did was I looked at all the doctors, and I was looking for a doctor that looked like me because I felt like I could trust a doctor that looked like me. And that's what I felt like I needed in my healthcare. I need someone who knows the culture, who knows, you know, so I don't have to explain every little thing to them, and they know how to approach me as a person, probably because they have some shared experiences with me. You have to do what's right for you. Get all the information that you possibly can. And then you decide what's best for you. And that's just the gist of it, because you're the one that's going to have to live with your decisions. I couldn't let anybody else make this decision for me as to what type of diversion I was going to have, because it was my life and I'm the one that's going to have to deal with it. I just think that a lot of times people think that you have to take everything on yourself, especially being from my culture. Mental health is very taboo. People take it as a weakness when you need to seek out, you know, help, you know, mentally. So it's important for us to help ourselves. And part of that was me interacting with a therapist that could help me, someone that I could trust, and someone outside of my house and my family and my life. It was enough for me to talk to my husband, but why did I want to? There were some things that I was going through I didn't necessarily want to tell him and burden him with, because he had his own burdens of worrying about my mortality or my morbidity. So I didn't want to, I wanted to be able to freely talk without having to worry about someone else's feelings about what I was going through. And it was very helpful.